So what medicines do we use for the treatment of fibromyalgia syndrome? Well, fibromyalgia syndrome is classified now as a type of nerve pain or neuropathic pain. And because of that, we use a wide variety of different medication options in order to treat it. We know that there is hypersensitivity in the nervous system, so we use a variety of medications which have an activity in the nervous system to try and dampen it down. Now, there's lots of different types of medication which are used. Some of the common ones include anticonvulsants, antidepressant medication, opiate medication, antiarrhythmic medication, and others. What's important is that a lot of the medications that are used for the treatment of fibromyalgia syndrome were actually used for these other indications, for the treatment of epilepsy, for the treatment of depression. But they're used at different, usually lower doses, for the treatment of fibromyalgia syndrome. Some of the commonest agents that we use for the treatment of fibromyalgia syndrome include things such as pregabalin, gabapentin, duloxetine, nortriptyline, amitriptyline, desulpin, and others. The basic principles with treating patients with fibromyalgia syndrome is to start with one agent and to start at a very small, low dose and slowly escalate that dose up. And the aim is to get to a point where you're able to get maximum pain relief with minimal side effects for the patient. Once this has been achieved, and that may be through one agent or a combination of agents, you would then maintain that medication for approximately 6 months, in which time you would physically and psychologically rehabilitate the patient. And then after the 6 months, the aim always is to try and slowly reduce the medication with a view to bringing the patient off it and completely discontinuing.